Welcome everyone to the TGP informative webinar, where we'll be talking about 2024 informative. I'd like to first of all take some time out to welcome everybody and thank you for taking the time out of your day to meet with us to talk about this process. This is our final round of the Compass Transformative Grant, and we will be awarding in June, and it will run through for 15 months until the month of September, where we will go over all of those details in the webinar. There will be funding opportunities, don't worry, this year, but this is the last year we will be having funding opportunities. Some have already come out, and some will come out as we move forward throughout the year. So please, not only come to this orientation for this, but please continue to be on our website and preparing yourself for other opportunities as they come. But today, we're just going to focus on the transformative grant. So welcome, welcome, welcome. I look forward to our time together along with my other partners, whom I'll be introducing very shortly. First of all, I want to talk about our presenters. I'd like to welcome in our time together the amazing Justin Searcy, who here representing the Southern AIDS Coalition, the incomparable Marcus Hawley, who will also be coming from Wake Forest School of Divinity, and the beautiful and the famous Masonia B. Traylor, who will also be standing in to talk about the many things that will be going on at the University of Houston Coordinating Center, and myself, Chris Matthews, who I'm here representing the capacity building efforts of the Emory Campus Coordinating Center. So I would like to say welcome to all of our presenters, and I would also like to welcome all of you who've taken the time out of your day to be on this particular call. So welcome all. So as I've said, I would like to thank you for coming to the webinar. This webinar is a part of the Compass efforts. As you may or may not know, the Gilead Compass efforts are scheduled to be, or they as $10 million to, or $100 million, I apologize, that were supposed to go out into the Southern community over the course of 10 years. So far, we've engaged over 400 people affected by HIV. We've collaborated with over 500 community-based organizations across 16 states. The Coordinating Center played a pivotal role in the work that we do, and we will continue to play that pivotal role, even though this may be our last year for actually funding opportunities. We will spend the next couple of years out in the community disseminating all the wonderful things we have learned from you as grant partners, and all the things we have learned as we have worked with each of you as you have done the work to better the communities that you serve. So we thank you for all the work that you've put in with us in the past, and we look forward for being out in the world sharing with you all our many accomplishments, most of which you've participated in. So for those of you who have been our partners in the past, take a few moments to give yourselves a round of applause and to pass yourself on the back. And then I'm going to tell you about our webinar agenda. First thing we'll do is we will spend some time talking about the Compass Initiative and the funding opportunities, and then we will take a little time to hear from each CC. Emory will come through and talking about building organizational capacity. SEC will talk about HIV-related, the reduction of HIV-related stigma. And so will Wake Forest. They will talk about it in the faith-based space. And then we will also have conversation with our partners at the Houston Coordinating Center, who will talk about well-being, mental health, trauma-informed care, and substance use. Then we will take a little bit of time to review the transformative grant requirements and the submission and review process. We'll talk about some important dates, and then we will do the part that you've all been waiting for. We will answer as many questions as we have the time and availability to. And just for some of you, as you continue to ask questions in the chat, some of those questions will also be answered, but we promise we will bring those important questions to the forefront of this conversation. And after this conversation, we will make this webinar available to you so that you can go back and review it in case there are things that you may have missed. And we will put out a few from this particular webinar. Should we find any questions that are reoccurring, we will put out FAQ so that you have the opportunity to be able to read some of these questions that we've answered. So the first thing I want to talk about is our partnership in addressing HIV in the southern states. As we said, the Gilead Compass Initiative was a $100 million commitment over 10 years to support organizations working in the HIV and AIDS epidemic space throughout the South. We've worked in, as I said before, over 16 spaces. We've had corporate giving programs. There have been independent education grants, and there was also the AIDS View partnership, where you got the opportunity to look at all of the work, or a space where we have mapped all of the work that we've done, mapped some of the disease state, and many of those of you who are doing the work, we've mapped that, and a multitude of other things. And you can look at those maps at our AIDS View site. It is a bevy of information, and we look forward to you also engaging with that information. Sorry. So today, as I said before, a multitude of our coordinating centers. We are represented by each of our partners. There is the Emory Rollins School of Public Health, where we focus on capacity building and sharing knowledge. There is the Southern AIDS Coalition, where they focus on education and anti-stigma. There is the amazing University of Houston Graduate College of Social Work, yeah, Social Work Month, where they talk about well-being, mental health, and trauma-informed care. And there is the Wake Forest School of Divinity, where they focus on faith-based HIV stigma reduction. Our mission in the Compass space is guided by local communities disproportionately affected by HIV and AIDS in the Southern United States. The 4 Compass coordinating centers are working collaboratively to build capacity amongst organizations, institutions, and other entities to reduce the HIV/AIDS disparity in care and advance equities in the Southern United States. To make a long story short, our mission is to work with our community partners to reduce the spread of HIV, or the disparity that exists in HIV disease, and to address inequities in the Southern United States. And to do so, we follow the following guiding principles, or we adhere to the following guiding principles across CCs. The first one is the meaningful involvement of people with HIV, MIPA, the intersectionality of social justice, emphasizing racial justice, openness and transparency in learning, collaboration and commitment, and a holistic approach. Our community investments is addressing the HIV epidemic in the South by supporting, growing, and working with organizations who focus their efforts on the community. We look forward to not only this work, but we have looked forward to all the work we have done with each of our community partners, and all the partnerships we have made an investment to grow the work in the South. Be able to better serve the people who we serve and do the work that we do. And again, we thank all of you participating in that work and partnering with us, because we believe that we're not funders. Across all CCs, we believe that we are community partners, helping our community partners who do the ground level work to make the difference. And so again, we say thank you. We do this by offering collaborative learning grants. There are capacity building grants. There are the amazing Spark grants, Action, and this grant, Transformative grant. Some of those grants for have already come out. And as I said before, some of them will continue to come out throughout the year. So just because this is our final year of support, or our final year of doing funding work, because we still will be supporting community efforts, doesn't mean that this is the only opportunity. Again, please be on the lookout for the multitude of opportunities that will show up on our website. So the first thing I would like to do on behalf of the Emory Coordinating Center is talk about the Compass Coordinating Centers. And the first one up is us. Here in the Rollins School of Public Health, that also houses the Emory Centers for Capacity Building and Technical Assistance, lies the Emory Compass Coordinating Center. And our goal is to create long-term and sustainable change in leaders, organizations, and ultimately communities by supporting capacity building strategies that strengthen the infrastructure and the support and the viability of HIV and AIDS serving organizations. And we boil that down to just a simple, what we do is we make the work that you do better by supporting your efforts to grow in that work. Here at the Emory Competence Coordinating Center, it is our goal to support all the organizations that we work with to give them the tools to be able to better do the work, to be able to better evaluate the work, to be able to better build on the work, to be able to better understand the work, and to train people to do the work in the way that makes them successful organizations. This year, our grant opportunity is focused on 3 areas. The first area is sustaining and advancing initiatives. The second focus area is organizational mentoring and twinning. And the third focus area is community and systems levels interventions. The first one, sustaining and advancing initiatives. Our goal is to consolidate gains from efforts, to require clear plans for sustaining and enhancing initiatives, emphasize the reassessment of goals and strategies and methods, and focus on long-term project sustainability and stakeholder support, to expand existing projects, but not to just fund ongoing projects. I want to take a moment to pause right here. When we say the expansion of existing projects, our goal this year is to fund projects that are already in works, but we don't want to just pick up where the last of your funding left off. Let me be extremely clear about that. One thing we want to do this year at the Emory Compass Coordinating Center is we want to expand that work. We want to make it better. That may mean a multitude of things, but what that doesn't look like is us just pouring money into the work that you've already done. So just because one of your funding cycles has ended, this is not your opportunity just to refund that funding cycle. Our hope for any project submitted under this particular focus area is that you will be doing additional work to enhance the quality or the outcomes of that particular project. We also want to include project adaptation, resource optimization, strategic planning, knowledge management, technology innovation, and quality assurance. All of these things you may apply to do under focus area 1. Here's some examples of what that work may look like. You may take some time to have a comprehensive project evaluation. You may want to take some time out to evaluate the projects you've already had. Maybe in the previous projects you've applied for, you didn't have the additional funding to do some evaluative work or to turn that work into a toolkit, perhaps. You may expand services that are already there. You may have been serving 100 people, and now you want to serve 200 people. We will fund that this year. Strengthening local health care partnerships and comprehensive care, enhancing data collection, developing a disaster preparedness program. Maybe you want to develop a new funding program, or maybe you just want to go through and enhance or train the people that you have doing the work to do that work better. All of these fall under sustaining and advancing initiatives and are fundable under our first focus area. Our second focus area is mentoring and twinning. We want you to be able to better do the work that you're doing. And we believe that one of the a pivotal way for you to do that is be able to learn from somebody else. In the past, we have allowed you to use consultants, which we still will do. We've provided you with coaching, which we still will do. But we also want to pay extra close attention to you learning from the people who are also already doing this work. So if there is another organization you would like to learn from, here is your opportunity. Under this particular focus area, you may partner with an experienced organization to enhance operations. You may do a little twinning and share insights and practices amongst 2 organizations to better the 2. Perhaps you may want to work with another organization to learn something about your organization or to be able to hone in on some of the skills that you're doing, focusing on expanding the work, especially in new or underserved populations where you may not have had expertise in the past. Funding for these organizations that are being mentored. One of the things about this particular focus area is if you are an organization receiving the mentoring, or you're an organization who is benefiting from working with a larger organization, in this particular space, we really want the bulk of that funding to go to the organization who is doing the learning. We know that it takes a lot of energy and effort for the other organization to put forth the time, the effort to be able to mentor another organization. So we understand that there has to be funding for that organization, but this is really a big opportunity for the organization that is learning. So we want the bulk of that funding to go there. Areas include cross-section collaboration, resource mobilization, problem solving, strategic outreach, service delivery innovation, and public health strategies. Here's some examples. 20 for advanced HIV treatment and patient support training. Maybe you are an FQHC or you're learning to become an FQHC and you want to reach out to another FQHC and learn how to do that work. Maybe you're a mental health provider and you want to get with another organization and use that organization, or not use, but pair with that organization so that you have a better understanding of how they have strategically done their work. Perhaps you want to collaborate to implement a peer support or outreach program, or learn from a mentor about organization administration. Maybe your organization doesn't want to learn about how to better serve the community, but you want to learn about those things that are infrastructure based, like how do I run the 16,000 reports that are required by HRSA to be able to facilitate this work. So maybe that is something you want to learn this year, and we will fund you to do so. Our final focus area is community and systems level interventions. Here we focus on transforming community norms and behaviors regarding HIV. We hope that you will tackle broader social determinants of health. This focus area isn't just about serving the individuals. This focus area is attacking things, or attacking those things that may hinder us from serving the community at a larger level, at the city level, at the regional level, at the state level. This particular focus area requires collaboration with multiple organizations for its effective service. You can't serve the system alone. So if you're writing for this particular section, you will also have to write as more than one organization. You will have to write in collaboration with other agencies. Projects should involve equitable decision-making and resource mobilization. That is a wonderful way of saying you've got to spread the wealth. So it can't be that one organization leads, has all the funding, and everybody else just has attached an MOU to say that we're going to work together. When you're writing for this particular focus area, you will also have to write in funding for each of the organizations, and you will also have to speak to how you plan to collaborate together, how you plan to monitor your work together, and how you plan to achieve outcomes together. This particular focus area also encourages innovation strategies for prevention, care, and community engagement. So in this particular focus area, we're looking for you to address, because we're looking for you to address the larger social determinants, we're also looking for you to have innovative strategies that address those larger determinants, whether they be in prevention, care, or community engagement. So here are some examples. Want to advocate for a policy change to reduce barriers to HIV testing and treatment. Okay, this is a particular area they write for under this particular category. If you want to address transportation issues, broader transportation issues across the city that stop people from having access to healthcare, this is the area for you to write for. If you want to address language and cultural barriers that stop people from engaging in healthcare within your region or within your city, this is the right area for you to write for. There are also some of our partners who will also be addressing advocacy in a broader and a bigger way. So be on the lookout for them as we continue this conversation. What are we looking for? We are looking for proposals that articulate the need in their priority populations to respect to HIV. That is a beautiful way of saying that we are hoping that you will tell us what the problem is and how you plan to address the problem. We also want you to make sure you're writing that your funding aligns for activities, and that when you're writing these projects for us, that there is some level of community engagement, and we are looking for realistic proposals. That means that the budgeting, the staffing, the time frame of the deliverables, and the work plans all need to match. I'm going to repeat that one more time because I think that's of the utmost importance. We're looking for realistic proposals where the budgeting, the staffing, the time frame, the deliverables, the work plans all match. So if you write something in your budget, there needs to be action steps articulated inside of your work plan or inside of your grant narrative. It sounds minute, but it's very important. And the last thing we're looking for is sustainability. We don't want projects that are only going to work while we're funding them. We want to know that once our funding is ended, that the projects that you put forth to us will live long after us. It doesn't do any of us any justice across any of these services or across the community as a whole for us to fund one-time projects and then they successfully provide services to the community and those services end when the funding ends. We do a disservice to our communities and to the people we serve, resource, and then we quickly take it back. Things to know. Our maximum request is $100,000. Now, that doesn't mean that's all the effort we're going to put forth at the Emory Conference Coordinating Center, but that does mean you can't write for more than $100,000 when you're writing for us. We will still be having quarterly reports. We require that each of us, or we require that each of our partners have an evaluation plan and a work plan, and that they deliver a final report. All of our reporting is important to us. So we are looking for those agencies who can adhere to making sure that they deliver our reports on time, and our evaluation plan and work plan are important to us. So even once you send them to us, we are going to work diligently with you to bring them up to a space that works for both us and you. Monthly coaching meetings, and then there will be bi-monthly project officer calls. That means you will meet with a coach because we will provide you a coach to provide you support as you do the work. And you will meet with me and Haneen, your project officers from Emory Compass Coordinating Center, every 2 months to update us on where we are with the work and to check in to see if you need any more support. I know oftentimes we think that our relationship with the project officer is just us making sure that you make your checks and balances. But here at the Emory Compass Coordinating Center, we're also looking to support you as the projects go along because we're in this together. We have agreed to be a team. Our funding and your hard work equals new outcomes and new supportive services for the community. Funds cannot support medical supplies like test kits, um, harm reduction equipment, or cannot provide direct provision of medical personnel, including CEUs. So for you can't pay for actual care. You can pay to develop a plan to implement that care better. You can pay to be able to make your waiting rooms more appropriate for the different populations you serve. You just cannot pay for the care itself. So there are so many things you can pay for around this project. And if you need to ask us additional questions about that, we will entertain them at the end of this particular webinar, but we will also be entertaining them at the Emory Compass Coordinating Center on Thursdays, 9 Central to 11 Central. I mean, 9 Eastern to 11 Eastern. I apologize. Things you also must know, you submitted documents are subject to change with the assistance from Emory team upon selection. As I said before, you may enter a work plan to us, but we may see as you've submitted that work plan to us that it needs some additional tweaking. And so we reserve the right to support you not to change your document without your approval, but to support you as as you begin to do your work and as we begin to evaluate that work. So we reserve the right to make some small changes to any of the documents you have submitted to us. I just want you to be aware of that. Priority is given here at the Emory Campus Coordinating Center to MSM of color, women, people of the Latinx experience, transgender and gender non-conforming individuals. Support for staff positions or consultants are acceptable under our funding. So you can pay salaries under our funding, or you can pay to have a consultant to provide you with some support as you begin to do your work. We will work collaboratively to develop evaluation plans and revise work plans as needed if you are selected. As I said before, we won't do this without your approval. We will work together with you and the coach so that we all can achieve better outcomes. Sometimes you just don't know what you don't know. We at Emory, sometimes we don't know what we don't know. And it's always good to have another set of eyes on any of the work that we have designed or that you have designed so that we can optimize their work so we can achieve the greatest possible outcomes. Grant recipients that choose to hire consultants to assist with capacity building efforts are not required to work with a particular consultant. It is not our job to tell you who you can and cannot work with, but it is our job to make sure that the funding we give you gets the best utilization from you as a grantee. And so that means although we don't require you to work with a consultant, we will support you in the vetting of your consultants. And if we come across a consultant that may not be in line with your project as a whole, we still reserve the right to say that this may not be the best consultant for you. So although you've selected a consultant, it must be approved by us in the final stages of the application project. As I said before, you can receive technical assistance from me on Thursdays, 9 a.m. to 11 p.m. That is absolutely wrong on my part. I apologize. That is a mistake for me. You can receive it from 9 a.m. to 11 Eastern time. And to set up that time, all you have to do is email Emory at Compass at gileadcompass.com and set up some time, and I will answer any questions or work with you in any way I can that is fair, let me say that, to all of the other people who are applying. Wink, wink, it has to be fair. So I'm not going to read your whole document before you upload it and then say, oh, this is great or this is not great. But I will answer any questions you have about what we're looking for as a coordinating center and what would be best as you are vetting out your projects. But it has to be fair to all of the people involved. So I'm not going to help you write your grant. That's not going to happen this year. With that being said, enough about the Emory Compass Coordinating Center. I am going to kick off my time in this conversation to the beautiful, the incomparable, the talented Masonia, who is going to tell us about the Sustain Compass Coordinating Center, which is housed in the Houston Graduate College of Social Work. Masonia, it's on you.
Thank you so much for that, Chris. And thank you so much for sharing the transformative grant opportunity for Emory University. My name is Masanya Traylor, and I am the organizational strategist and community liaison for the University of Houston's Sustained Wellbeing Center Campus Coordinating Center. Our university center is housed at the Graduate College of Social Work. And this grant opportunity is under Sustained Wellbeing Campus Coordinating Center, where we center our work around trauma-informed care around the HIV/AIDS initiatives, specifically building the capacity for organizations around wellness, trauma and healing, mental health, substance use, particularly harm reduction and opioid use. And all of our work centers the meaningful involvement of people living with HIV and AIDS around openness and transparency in all the work that we do. All right, so our trauma-informed care organizational change is our grant that we use to focus on transforming the culture, the infrastructure, and all the internal processes around your organization that you're working with. So what that can look like is your hiring practices, how you train, your onboarding practices, how you screen your employees, or even your volunteers that are participating and engaging and interacting with uh, the members of your organization that are HIV and AIDS. One of the other things that we really hone in on is policies and procedures. So we take a look at what policies and procedures you already have, or if you need assistance in developing them, so that, as we know, the intentionality, the commitment, and the management organization is being trauma informed. And oftentimes that language and that information on how we do that is not usually written in the black and white within those policies and procedures or the onboarding process. So we also assist with that within participating in the trauma informed care organizational change. Now, within this grant, it includes 3 major phases, which is the pre-implementation phase, which lasts about 4 months, the implementation phase, and the sustainability phase, which we will go into in just a moment.
If I may just add one thing, Ms. Sonia. If you go back to the previous slide. Hello, everyone. My name is Marcus. I work very closely with Ms. Sonia on the transformative grant. As it relates to these 3 major steps, what I would like to point out is, even though sustainability is listed 3rd, we actually start talking about sustainability during the pre-implementation phase. So even though it's like listed as 3rd, sustainability is threaded throughout the whole organizational change initiative.
Thank you for that, Marcus. And we will pull that up some more when we get to the roadmap, as we address some of the pieces of the roadmap too. So all of our work, including the staff, our team, inclusive of Marcus Stanley, is guided by these 6 guiding principles to a trauma-informed care approach. So everything we do ends with these 6 principles: safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and the cultural, historical, and gender issues that we address. So everything that we do is embodied in how we show up in our work. So this grant can be very, very, very confronting. It is going to take something within you personally to really address your organization and the people that we serve living with HIV around these 6 guiding principles. These principles will be the foundation of creating the sustainability that's going to be needed for your organization over the 15 months that we'll be doing the work together. Next slide. So why trauma-informed care organizational change? Now, as we know, the landscape of HIV has been a little rocky, or doesn't feel maybe really progressive in some ways, and particularly in the South around the HIV epidemic. So we still see an ongoing lack of support and a lack of resources that can help engage in our structural change that is needed and required to end the HIV epidemic. All right. This right here can show that it's not only harming those that are living with HIV, but also the staff, and how the staff are treating each other, how they're treating themselves. And that ultimately will be a reflection of how the clients will show up, or the communities in which we're serving, in how what we're needing for ourselves. And as you see, I'm using the we and our because I failed to mention this in the beginning, but I too am living with HIV. And so in this work, there's transparency within being knowledgeable of what community is and what community needs. And so there's transparency within that. Now, we also know that trauma-informed care organization change can improve, and has been shown. It improves that your employee development, um, employee engagement, the retention of employees. So when people feel seen, heard, they're usually more willing to stay longer and invest in your organization, and bring on really good quality people and develop what pieces are missing a bit more. So there's more intentionality around it. And then you ultimately create a better outcome around user satisfaction, the engagement, the innovation, like the creativity and enhancements that you may want to create within your organization, because you have this peace and freedom around showing up for your organization in a different way with a new lens and support. All right. So here's the roadmap that I mentioned earlier. This transformative grant partnership will last 15 months. In the previous years, it was 18, but this year it will, for this grant cycle, it will be a total of 15 months. Your pre-work, as we talked about the pre-implementation, will be from June to September of this year. The implementation part happens for the year of 2025 from January through September, so for a total of 9 months. And we will close out in September. Now, in December, excuse me, where you have a few more trainings that are left, but more so you're implementing all the things that you've done, and then we'll present towards the end what you were able to accomplish, or that you still need working on for you to continue your sustainability within the organization. In the first 4 months, well, throughout the project, you will have access to technical assistance. We provide consultants. You do not get your, you do not seek out consultants. We provide this consultants and the technical assistance. This grant will also, you will also receive monthly coaching calls with me. And sometimes Marcus does join those coaching calls, but they will all be guided by me. So your leadership team, which will consist of 2 change team champions, that will be a combined full-time employment of 1 full-time person for the whole project, as well as 2 people living with HIV that would be recruited to be included in not only your proposal, but also throughout the whole project. So it will not just be you as an executive director doing everything. We are looking for a leadership team to participate in creating transformational change with the trauma-informed care support and lens throughout the project. In regards to one more thing, in regards to your work plan for the 15-month roadmap that we have, your work plan is, because change is always happening, your work plan will be a living document. So there may be things that occur that will change over time, that gets updated. So it will be not a one and done. We did this work plan, it's been submitted. There may be things that you hadn't considered or hadn't thought of or didn't know that you didn't know those things that will be considered and brought up for your organization to strengthen where they are, where you want to go, and how do you get there in the process. So I just want to make sure I acknowledge that. And within it, you'll continue to have support from those consultants with the technical assistance as well. And myself, I'm pretty accessible throughout your project. So there is no timestamp for what time we begin and end. We will create that together when you're onboarded. Right. So what are we looking for? As I mentioned before, this opportunity can be very confronting in regards to who you are being in this work. So what we're looking for is not perfection. We're looking for someone who's willing to be open and guided with change. we're definitely wanting to center those communities of that identify as Black communities or Latinx communities, and those organizations are being led by those individuals would be really helpful too. We're definitely looking for organizational change. So that means that your leadership team has to be involved. They have to be involved. There's no wiggle room for this piece. So that means if you're applying for this grant, your leadership team must have the commitment to participate in this project. All right. This is guided by, once again, MIPA. So the meaningful involvement of people living with HIV and AIDS, what that looks like is there's no decision being made by your leadership team without the input of a person living with HIV. It is guided within that. So it's a community togetherness practice. We're also looking to integrate racial justice. So naming things that may be uncomfortable, but also working through those pieces and giving you support and training and information around what that looks like and how that is implemented throughout your project. And then also answering guiding questions in a clear way. There's more information that you can receive with the YouTube link here that we'll put also in the chat box. And then all of this is also written within the RFP. So when you apply for the grant, it's also listed within the RFP. All right, next slide. So the key takeaways, y'all, what are we gonna tack away? The key takeaways that we have for this grant opportunity is that our Sustain team believes that organizational change is the key to life-saving transformative change. We know that if we start with leadership and there's some changes that are happening there, we start with policies and it's happening there, it will have an immediate effect on how we're servicing the people in our communities in which the organization stands, right? And the more that we create around being more trauma informed, the more receptive and receiving that will save the lives of people who are living with HIV, that they may be more willing to adhere to their medications, they may be more transparent and talk more, they may be more committed to even supporting your organization in a way that you had not experienced or thought that they would before. And for those who are already committed, you may reignite something in them that makes them want to do more or do less with more. Like they're treating themselves more kindly. There are many things that you may see that develop and transform in this. Also, the organizational change process, like I said, is very confronting. It is not an easy process. There are some bumps and bruises that you may experience along the way. It's not just confronting in who you're being as a leader in this work, but who you're being to yourself in life. All right. I did ask one of our past transformative grant partners what was something that they would want to share with you as a key takeaway is that you should remain patient with the process and recognize that to begin learning in trauma-informed care-focused space, you must be open to healing yourself and being vulnerable with your team. All right. So it is not necessary for your organization to succeed and grow without understanding that this will not be an easy process. Just really making that very clear. It's not going to be an easy process, but it's so worth it because it's necessary for your organization to succeed and grow. You got that? All right. This grant will also allow you to reflect, plan, and execute organizational trauma-informed care change with our Sustain trainers and coaches. I mentioned that before, and you will consistently receive that support. So although we'll be meeting monthly to go over your work plan to see where you are, you'll be receiving your ongoing trainings through that roadmap that you saw. You will receive additional support when asked for, when needed. If we see any gaps, we'll call you in and say, hey, well, how can we support you with this? More tips for successful implementation are also located in the RFP. And that is it. And so I'll pass it on back to Chris.
Before you pass it on to Chris, I just want to say within the RFP, specifically for the Sustained Wellbeing Compass RFP, there is a plethora of information that will make for a successful proposal. As well, there's a detailed explanation of the initiative, who's to be a part of the initiative and what are their roles. This is very important that you review this because this is an intervention and not much of this landscape, if you will, of the project will change.
Thank you, Lasonia, and thank you, Marcus. And although I love to hear myself talk, I am not the person who needs to be at the microphone. So without any due time, I am going to pass my mic over to the amazing and the talented Justin Thursday. Justin, tell us about what's going on at the Southern AIDS Coalition. Zach, give us the grease.
Thanks, Chris. Good afternoon, everyone. My name is Justin Searcy. I am the Grants Program Manager for the Southern AIDS Coalition. And I'm going to go ahead and just jump right in since that's what we're here for, right? The Southern AIDS Coalition is offering the TGP grant, obviously this cycle. And the mission of the Southern AIDS Coalition Compass Coordinating Center is to reduce HIV-related stigma in the South through grants, training, leadership, development, empowering individuals impacted by HIV in order to maximize the collective impact on HIV/AIDS in this particular region. Next slide, please. So our mission at SAC is a nonpartisan coalition of government, community, and business leaders working alongside thousands of people living with HIV and their allies, but specifically to end the HIV epidemic in the South. That is our mission and our focus and our goal. Next slide, please. So for our vision, we envision a better South for people living with HIV, one where every person has access to high quality healthcare and essential support services, free from stigma and discrimination. There's also another portion to that. And we also envision a South where every person understands the risk of HIV transmission, receives routine screening, and has access to full range of prevention, intervention, and harm reduction services. So this is where we're trying to go, and this is exactly where our outcome is headed towards. Next slide, please. So for for SAC, we offer 4 different components or opportunities, so to speak, that you would ask for through Compass. First, we offer trainings on how organizations can provide culturally appropriate, non-stigmatizing services for people living with HIV and other marginalized communities. Secondly, we offer shared learning opportunities to pilot existing HIV-related stigma reduction interventions in local communities. Additionally, we offer Spark grants, which some people may have seen currently, to fund community-led grassroots HIV education, awareness, and stigma reduction campaigns. And currently, we're offering, and what we're here for today, the transformative grant, which is to fund the design, implementation, evaluation of new interventions to reduce HIV-related stigma for people living with HIV. So the TGP grant offers 2 different focuses. Our first focus is intervention development or adaptation. There are 2 different components or specifically areas of what we focus on. Original intervention with a proposed comprehensive formative process that takes into consideration existing programs, gaps, and relevance to the culture and experiences of community of focus. Secondly, adaptation of existing evidence-based interventions with a proposed comprehensive process and a justification for developing additional content that specifically addresses HIV-related stigma. So that is the first focus of what we're focusing on within TGP. As we focus on the second one, next slide, please. That would be considered as the intervention implementation. Proposed projects in this focus area should result in implementation of intervention that was previously developed and piloted by the applicant. In the focus area, your project should culminate, in a minimum of one complete cycle of your intervention with program evaluations through in the entire process. So when we're looking at intervention, I guess you would kind of ask, what exactly is this saying, or what is the next step when you're thinking of intervention? Next slide, please. So you asked, what is an intervention? So we're going to give it to you. By intervention, SAC specifically means a combination of programs, elements, or strategies designed to reduce HIV-related stigma, both internally and externally, by either influencing knowledge, attitudes, behaviors, or skills among those people or people living with HIV, increasing social support for people living with HIV, or creating supportive environments, policies, or resources for people living with HIV. Next slide, please. So what are we here for, and what are you looking for? So SAC is planning to offer or award up to $100,000 in direct funds for applicants that are intentional in the application of MIPA principles, demonstrative of the applicant's alignment with Gilead Compass Initiative guiding principles that we've spoken of throughout the day, located in communities that currently lack stigma reduction resources for people living with HIV, are led by members of the community, and then lastly, clearly defined and developed with appropriate SMART goals and objectives to create a vision. Next slide, please. So lastly, this is our timeline and the grant timeline of what we would have if you were awarded. So I would be the person that would be in correspondence with you. I would work with you throughout this whole process. Initially, if you were funded, this process would start in June of this year and go through the pre-implementation phase, which aligns your part and my part. The initial part that we would offer would be, for the pre-implementation phase, would be the TGP orientation, the welcome from SAC of being a official grantee, evaluation, workshop, and the first payment that would be offered to you within 50% of what is offered to you as total. What you would need to bring to the table, though, make sure that you have your contract, your W-9 form, revised work plan as well, if you have that. Quarter one, which would be July through September, that would be program implementation phase, the program development one training, and then we would sit down and have a check-in call and a quarterly report that would be due that particular quarter. Next quarter would be quarter two. The second payment would be issued to you of 50%, the other 50%, the remaining 50%, the program development two training, and then we will sit down and specifically talk again and have another check-in call and a quarterly report, making sure that you are on goals and making sure that everything is planned the way that it needs to be. Going into 2025, quarter three, program development three training would be what that quarter would be consisting of. Check-in call and a quarterly report would be what was due during that time frame, April through June. The midpoint is when we would have a specific in-person site visit. I would come in and speak with you, talk to you, specifically try to figure out and make sure that we're on track with our goals, make sure that the vision is being accomplished the way that you desire, and making sure that all things are tight, and make sure that everything is right for where we're needing to go as we're heading out of the cycle. So that quarterly report would be during that time too. Quarter five would be July through September. At that time, another check-in call, as well as another quarter report would be due. And then lastly, to end the cycle, which would be quarter six, would be have a virtual program closeout. We would issue different program evaluations so that you can evaluate the program and specifically your tenure, but from the pre-implementation phase up to this current time. And then at that time, the final report will be due. And I will actually include my email address in the chat if there's anything that's needed outside of any questions. I also can give specific examples if you need to chat, or if you need to email me.
Justin, you have a question in the chat box. It says, is this grant envisioned more for community events, marketing, or outreach, or could it be applied to medical interventions that include an educational / anti-stigma component, for example, a mobile sexual health unit?
I will refer to my supervisor because I want to make sure that I'm actually answering the question to all capacity. So Mr. Harris, could you help me with that, sir, please?
Sure. So this grant is an intervention. It has to be either one that has been tested and tried by an individual or one that is adapted from something that has already been proven. So while it could be, I wouldn't necessarily attach it to a marketing or outreach, but it is an intervention that is really wanting to change the narrative, change the landscape, shift the landscape around stigma and how it shows up in care, in the way people engage with community folks, in the way folks engage in their care experiences. So while it can be utilized for a mobile sexual health unit, but the goal is to have it being something not that is being tested out for the first time, but something that maybe your organization has been doing, and now you want to put money behind it to make it a little more robust, to add some additional components to it. And the only thing to be mindful of, it is not something that can support any particular care practices. So if it is to, get more people to be actually tested versus the experience they have when testing, then we cannot fund that. Hopefully that makes sense, what I'm saying. Oh, very helpful. So you're welcome.
Okay.
Thanks, Chris.
And thank you, Justin, and thank you, Marjoricus. Thank you for SAC. Now that we have marched the streets of Birmingham in our attempt to advocate with SAC, let us move on to our amazing partners in the faith-based community where all the advocacy first started off. Marcus.
Yes. Thank you, Christopher. Good afternoon, everyone. My name is Marcus Hawley. I am the Strategic Partnerships Manager with the Faith with the Faith Compass Center. We are actually rebranding right now. And here just to give you a little bit more information and insight into our particular transformative grant, the Faith Transformative Grant. Next slide, please. All right, so a bit of an overview just about our center and what we strive to do. Again, we are the Faith Compass Center. We are rebranding, and we work at the intersections of faith and HIV. So one of the things that you can think about, you've heard from all of our Compass partners, and we do a little bit of what each of them do, but with a faith lens. So we do some capacity building, as you see down there. We do some interventions and some educational programming and different things like that, but we do it through a faith lens. So put everything that you've heard today, and if you're applying for our transformative grant, it has to be working within the faith space. So that's where I would like to get started with that. So we do storytelling, and our storytelling, a lot of times, we say transforming the story. How do we transform the story? So we do that in several different ways. We do that via our social media. our social media channels, which is mostly like Facebook, Instagram, and LinkedIn. We also do it through a newsletter, as well as through our ambassador program that we piloted and will be launching nationwide, at least in the 12 Deep South states this upcoming year, as well as partnering with experts that work currently in HIV, but again, have that faith lens. So it could be a therapist that we're working with, someone who does trauma-informed care, but they do it through the lens of faith. So they may be a minister or a pastor, but they also have this license to be a therapist as well. The other things that we do is training. So majority of our training is done with our funded partners or our grantees. So if you were to be awarded a transformative grant, you would be considered our funded partner. You would be able to, attend our training. So a lot of our trainings, again, are the things that we've heard in the past from different faith leaders, different organizations, expert or executives who run these different organizations, saying these are the things that we need. So we may do grant writing, we may do something about trauma-informed care, just different things like that. So those trainings are mostly for our funded partners or our grantees, but we also do public trainings, webinars, panel sessions, things like that. We also have some more in-person trainings or webinars, symposiums that we've done, some things that we've done in the past. We've hosted some conferences. We've hosted a retreat, also a Black Men's Health Symposium, as well as a sneaker ball in our first year. So those are just some of our in-person training / programs. And then lastly, the funding priorities that we have, and specifically for the transformative grant, capacity building, programming, educational programming, and social determinants of health, particularly with health ministry. So that could be you wanting to create a health ministry, or how to, learning how to be more sustainable, or how to build a more sustainable health ministry. Next slide. All right, so our focus is to support infrastructure and programming that enhances all of these things. So employment, education, transportation, think of it more holistically, if you will, around people who are either living with or at risk for acquiring HIV. So we're looking to support projects, interventions, things like that, that are supporting these different types of services for people living with or at risk for acquiring HIV. Our aim is we are interfaith, which basically means we work with all different types of religious groups. And we're mostly, as you see right here, we're mostly Christian, but we are, again, interfaith. What we're looking for is folks that who are working to reduce stigma and eliminate stigma within faith spaces, create inclusive faith spaces, both in person and virtually, that are accepting, affirming of LGBTQ plus persons, people living with or at risk for HIV, and all of the other, examples in this on this particular slide. Next slide, please. So what makes a strong application? So what we like to see is an application that can clearly articulate what your project is doing and how it will address people living with or at risk of acquiring HIV, again, through the faith lens, right? One caveat is letters of support. Like I've talked to some people already who are planning to apply for our transformative grant and asked about letters of support. Letters of support can only strengthen your application, and we like to see that. So if there are partners, collaborators that you've worked with previously, or even plan on working with in your current project for the transformative grant, we do ask that you submit letters of support along with your application. We're looking for clarity on how your program will be delivered. So this includes any kind of communication platforms that you might use, social media, newsletters, email blasts, etc. we're not too worried about your project being too small. So we're not worried about that in the sense that, you know, you can have some grassroots efforts, right? That dig deep into the community. But we also, one thing about that is we also want you to actually be an organization that already has those resources and things in place. So you already have some infrastructure in place. You already have staff members in place that can also, you know, create and implement those grassroots projects. So although we're allowing grassroots projects, we don't necessarily want the organization to be grassroots. The organization needs to be a sustainable organization that has been around. But again, you need to be able to prove, strongly prove, and clearly, you know, prove and articulate the things about your project, your grassroots project. And also, I would ask that you think more focused rather than big. So again, if you're doing a grassroots project, how can you really get into this community, break down some of those barriers, instead of thinking so broadly, think very, very deeply. And that's what we're looking for. Next slide, please. So again, more of what we're looking for, innovative approaches to addressing HIV stigma, especially in faith-based communities. Again, partnerships that you've either had or partnerships that you're going to work with. Again, someone that I spoke with early last week was talking about partnerships. They already have 3 partners. That's going to go into their application. Those partners can also provide letters of support in wanting to work with this particular organization. Are you able to hit the ground running? Do you have the capacity to go ahead, and as soon as you are awarded the funding, can you go ahead and get started with your project? Again, that kind of goes back to what I was saying earlier about the whole grassroots thing. Like, we want your organization to be an organized organization that is able to run, and not somebody who, just because you're putting on a grassroots or have a grassroots project, doesn't mean we want your organization to be grassroots. You need to be able to hit the ground running. So that's a good question to ask yourself. Are you able to do that? You need to be able to clearly articulate and communicate and implement your communication plans and your implementation plans. Next slide, please. All right, so this gives you a little bit about with our timeline and our funding parameters. So the funding will be released sometime in June. That will be 50% of your funding, and then the rest of it will come in the new year, so 2025. We're looking at about January 2025 or so, January to March 2025, so think Q1. But June 1st to September 2025, all of your funds need to be expended by September 2025. And you can see the dates right here for your quarterly report. So just think every quarter, you're going to have a quarterly report that is due. Currently, if you are receiving transformative grant funds, you are not eligible to apply for this grant or for this type of funding. And this grant will not fund individuals, general operations, endowments, or fundraising events. And lastly, grant recipients will be required to provide a narrative report and a budget report at the end of the grant cycle. Next slide, please. And lastly, again, these are some important dates. The deadline for application submission is April 11th. And so during April, we'll review those grant applications and proposals. Award letters will go out in May. And again, the first 50% or the first half of those funds will be dispersed sometime in June 2024. And as you see, to be decided, monthly mandatory workshops, trainings, et cetera, will be sent out once and scheduled once we have everything tied down. And that's it. Oh, one more thing. So here is our, can you go back one more? Yes, that is our information. I'll also, so compass@wfu.edu is our center, email address. My colleague Mia has also put that in the chat, and I'll also say that you can also email me here. She's put the website in the chat, but you can also email me personally, or you can email our Compass email address as well. Thank you.
All right, I just want to take a little time to speak on behalf of our partner, our missing partner, ETR, who does our monitoring and evaluation. Here's some things you need to know. All organizations will receive centralized evaluations. So you may receive evaluations that are specific to the CCs for which you apply, but everybody will receive overall evaluations. Those evaluations may or may not be quarterly. As things are as times are changing every day, and we won't get by with those same old ways. So the centralized evaluator will facilitate continuous improvement through establishing data-driven programming, monitoring, and evaluation systems throughout the Compass initiative. Our evaluating partner is Advancing Health Equity, as you may see, ETR. ETR is a non-for-profit organization that advances health equity by designing science-based solutions and brings nearly 4 decades of experience in the field of HIV, sexual, and reproductive health for youth and for families. So, why so much emphasis on evaluation? Our goal is high impact, scalable, and fundable interventions. That means if you did it once, that was good, but twice is even nicer. We want to effectively strengthen the core capabilities of emerging organizations and develop skills in implementing trauma-informed care in organizations and practices. That means that we are looking to both enhance the organizations, whether it be with the Houston and through trauma-informed care, or with Emory through just making sure you have core capabilities as an emerging organization. We also effectively want to shift attitudes and behaviors, whether you are leading a protest with our amazing partners at SEC, or whether you are trying to change the very core way in which faith and HIV interact with our amazing partners at Wake Forest. Either way, we are monitoring and evaluating those things so that we know that they are scalable, that they have high impact. That means that at the end of these projects, something has changed, somebody has been touched, there are outcomes to be reviewed. And we want to create models across CCs that can be effectively replicated throughout the South. We don't just do this work on a one-off. We constantly ask that this work be sustainable and that it can be recreated, because although you may think this is a one-time project, there is, I guarantee, another organization right now somewhere trying to do the same work you do with the same amount of resources, and they need to know how you did it and how you did it well. So ETR will always be here serving as our evaluator and reaching out to each of you, whether it is to have some interviews or whether it is to fill out a report. Be on the lookout for a multitude of interactions with ETR in your time with the Transformative Grant Project. So let's talk about the Transformative Grant overall. I know that after listening to Marcus talk about Wake Forest and the Faith Center, everybody is thinking, I'm just going to apply for all the grants and put it in the Lord's hands, and maybe it will pan out and my bank account will swell. Unfortunately, that and a multitude of other stipulations are not allowable in the Transformative Grant. So let's talk about it as a whole. Eligibility requirements. You have to be in one of the 12 southern states: Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, Mississippi. Love my people from Mississippi, North Carolina, Oklahoma, South Carolina, Tennessee, or Texas. You have to be doing your work. To somebody's questions in the comment, you can be doing that work across the region and other places, but your funding has to be able to go to the work that is being done within these regions. So if you also are doing work or the same work and you're looking to expand upon a project and you want to put some of that focus in this geographical location, by all means, we will fund it. And then that way you can shift that old money to do something different, right? You must have a non-for-profit status. That means as an applicant, either you or, to somebody's questions in the chat, or your fiscal sponsor must have a 501c3 status. So you may have a fiscal sponsor. And to answer or to touch on some of the conversation that has already came up in Q&A, you can decide whether you want, if you're a new agency and you just begin to do work under your 501c3 status, you can take out some time, or if you decide you may apply under your 501c3 status, although you will still have to prove that you have a history of doing the work. Or if you had a physical sponsor and you still want to use that physical sponsor, you can still use that physical sponsor. That is something I would suggest you talk to with each of your CC partners so you can get the outcomes that are best for you. The grant period, as every CC has told you so far, it is a 15-month period. It will start in June of 2024 and it will end in September of 2025. Let's say it again for those in the back. It will start June 2024. It will end September 2025. The award amount varies from CC. Some people will max out at $100,000. Some people will max out at a little bit more. So you just will have to look at the CC specific requirements. Some of those funds are not direct funds. So that means that a CC may award you up to $100,000, but also may put extra $30,000 or $25,000 or $20,000 in efforts for your projects. So that's why it may vary by amount. And just in case you missed it, I'm going to go back one and say June 2024 to September 2025, just in case. You will be required by some organizations to fill out an assessment because we want to know where you are before we begin the work. And you must agree to partner with ETR so that they are able to better evaluate the work that you're doing. Just some highlights, just in case you missed them. Must be working in 12 states, gotta have a non-for-profit status or a physical sponsor, only gonna have from June 2024 to September 2025. Award amounts may vary, may have to complete a survey, and we'll have to work with ETR for evaluation. Just in case somebody has stepped out of the room to go listen to your cell phone, or you were sending a text message, or maybe you were taking a little bit of time out in the chat. One application per agency. I know, right? Why not apply to all of the CCs and let God sort it out? Unfortunately, although it sounds very Southern and we are pro-South on this particular call for this particular opportunity, you can only apply to one agency, okay? One agency. And again, here is a quick, brief overview of all the things that are happening at each agency. We have Emory Campus Coordinating Center with organizational capacity building. We have our partners at Houston with well-being, mental health, substance abuse, and a extremely powerful focus on trauma-informed care. We have HIV stigma reduction at our partners at SAC. And for our partners at Wake Forest, we have faith-based HIV stigma reduction. Just in case you missed the many things that we said as we went over the many sections that we had before we got to this piece. Unallowable activities. Just so you will know, this project does not pay for medication, so you cannot focus on PrEP or pre-exposure prophylaxis. We don't pay for medical services, so you cannot. Procedures and policies include community members from receiving adequate and efficient healthcare, safe shelter, counseling, other assistance based on their actual perceived sex, age, immigration status, race, religion, sexual orientation, gender, mental health condition, physical health condition, criminal work in the sex industry, or the age and gender of their children. So we like to say that our work should be able to touch on everybody who is experiencing the impact of this disease. Well, if you're going to exclude somebody, then you may not be funded by one of us. Procedures and policies that compromise the confidentiality or the information or privacy of people being served. Projects, designs, and budgets that fail to account for the access and the needs of individuals with disabilities or limited English proficiency, or those who may be deaf or hearing impaired. Projects that place a criteria or requirement for community members to access services. That's not fair Okay, if we give you the money to be able to serve everybody, you can't put any crazy or any undue restrictions on those people's access to these funds. Projects and activities that promote or create safe, unsafe, uncomfortable, or counterproductive work environments. Because not only do we believe in serving the community, we also believe in serving those who serve the community. Project activities that exclude staff that are representative of the community being targeted through this grant project from serving in leadership or advisory capacity. And grant funds may not be used to provide legal representation in civil, criminal matters such as family law, divorce, custody violations, and child support, housing cases, consumer laws, and other legal cases. Application submission. Here, a beautiful picture of our application. And here are the steps. Download the RFP, go to our site, look through it, take some time, get familiar with it, build a relationship with it. Nothing works without a relationship. You wouldn't even be in relationship with McDonald's if you didn't know the fries was hot. So get to know our RFP, take some time out, work on your grant opportunity, then prepare your responses because this is an electronic application unless you decide to submit an alternative for the written application piece or for the electronic application piece, which you have about. I'll get to that in just a minute. Submit an application online here at Compass Initiatives on our secure platform. Remember, hit the apply button. Submission requirements and deadlines. Here we go. No applications via email, fax, email, or express delivery without prior written request and approval. And you have until Monday. Yes, this Monday that's coming up, March the 18th by 11:59 Central Standard Time to submit your application. And that is wrong. We never do anything on Central Standard Time. That should be Eastern Time. You have until 11:59 Eastern Time to submit a request to be able to give us an alternative application. Maybe you have a lot of your team that is hearing impaired, or maybe you have some of your that may be have some language barriers, and you want to have an application that's submitted by paper, or you want to have an application that's submitted by video. I don't know. We don't know if we can or cannot until you ask us. And we will do everything in our power to let you have a different or alternative application should you need it, because you will have to prove that you don't have the ability to submit it the same way or that you need a special accommodation. We will do everything in our power to give you that special accommodation. Why? Because we're on your side. Submission deadline is Thursday, April the 11th, 2024 at 11:59 p.m. Central Standard Time. I don't know why this keeps saying Central Standard Time because we do everything on Eastern Time. I think it's me. I'm the culprit.
No, it's not you. We actually did everything on Central Standard Time last year because our earliest time zone is Central Standard
Central Standard Time.
And we wanted to give everyone till midnight in their, at least to midnight in their time zone to complete the application.
Okay. Well, then I stand corrected. Okay. Until 11:59 Central Standard Time. Thank you, Marcus. I can always depend on you for getting me on the right track. Application components. Here you go. Your application must have a project cover page. It must have a project narrative. It must have supplemental materials. It is the required supplemental materials are as follows. You must have a project budget. And back to a multitude of conversations that were had, it must match the work that you're doing. You must have a work plan unless you are submitting a proposal for UH, because UH has already said they don't need a work plan. We've already got a work plan for you. Got to have a 501c3 or have to have a physical sponsor. You need to have a 990. We will also ask you for a list of your board directors and a diversity table for your staff. Optional, you may include some memorandums of agreement or letter of support, depending on which agency you're applying to. The review process. We don't do the reviewing in-house. We have a list of independent reviewers, and they will provide us they will provide us with the opportunity to determine which of these projects are the most. Go ahead, Marcus, you have a hand.
Yes, I just want to make one caveat as it relates to the University of Houston. You will not have to submit a work plan at the application process, but during the implementation of your projects, you will be developing your work plan.
Okay, Houston's got a job for you. Thank you, Marcus. Representing each of the programmatic areas and representing our priority populations, and they will follow the rubric to score the application, the rubric that is already listed inside. The rubric is the same across all CCs. Now, the rubric is the same across all CCs. Here are important dates to remember. If you need a request for special accommodations, please email them by Monday, March the 18th. I don't know if I said that already or not, but please email them by Monday, March the 18th to your specific CC. The application is due by April the 11th, 2024. Notice of funding decisions will go out May the 20th, 2024. Public announcements will go out in June. The grant period begins in June and ends September 2025. The grant period begins in June and ends in September of 2025. Applications due by the 11th and special accommodations are due when? This Monday. Go figure, right? That brings us to the end of our time for talking. We've said all the things that we've needed to say. Now, here's your opportunity to ask us all the questions you wanted to ask. And I will open up the floor for any questions.
We have one question in the Q&A section. They said a new organization, which is 3 to 4 months ago, won't have a 990. So it sounds that this type of organization must apply under a fiscal sponsor. Is that correct?
I would say yes. If you cannot give us a 990, then you will have to apply under your fiscal sponsor. Unless anybody else. Any other questions? Is that it?
If I can say for Emory,
I was about
yeah,
to
for
say.
Emory, we don't require 990s. So as long as you have been in existence at least 2 years doing HIV service work and you have your 501c3, you can apply to us.
Yeah, and I was about to say the same thing with University of Houston. A 990 isn't required if you haven't had one, but you would have to show how you've been doing the work.
Okay, well, there you have it. The leadership team has spoken. So then I rescind my answer. Then the answer is yes. You can still apply. No 990 needed. Okay. Any other questions from the chat?
There's one, where are the applications forms located? I looked on the website and downloaded the RFP, still cannot locate them.
First, you said the application form, or you mean
Seems like
apply for the application
yeah.
itself?
I
It
just
seems
put
like
it in
Kia
the
just
chat. I dropped
the
the link, and that link is all of the RFPs, all the application links, and all of the information that you need to know in reference to all of the
and to electronically apply, you will be taken to a central location for the TGP application. From that central location, you'll have to decide which of the TGPs or which one of the centers you want to apply for. Then you can click apply under that specific CC. Once you click there, at the end of that page, you will have the apply button for the specific application or to input your specific application. So just follow the click-throughs and you should be good, well on your way. Any other questions?
Yes, one more in the chat, in the Q&A section. Are we allowed to use the funds to give smaller grants to existing resources in our communities?
I think that
can you speak a little bit more about like smaller grants to existing resources in the community? Can you speak a little bit more about what that means?
If you can write that in the chat, whoever asked that question, and then we'll come back to it. But let's get to another question. Does the previous faith action equate to this transformative through Wake Forest?
Say that one more time.
Does the previous Faith in Action grant equate to this transformative grant through Wake Forest?
No, so when I said that you are not eligible to apply, I was talking about anybody that was already receiving funds, transformative grant funds from another CC. So if you have Faith Action, you're fine. You can still apply.
And to somebody's
think that-
question in the chat, Oklahoma is included.
Marcus, I think the question was, is the Faith in Action grant and the transformative grant the same thing?
They are not. No, they're two different grants.
If the organization has received funding from one initiative, are they able to apply to another? That is also a CC specific question. And so it just depends. I know from Emory, you may
Let me
be
hop in real quick, Chris.
okay, go
If
ahead.
I'm understanding the question correctly, is if you've already received funding for TGP from, let's say, U of H, can you apply for a TGP at Emory? If that's the case, is yes.
Yes. But if you're asking if you're currently being funded under a grant opportunity from another CC, that answer may also still be yes. You may have received a smaller pot of money from another organization or another CC to do something, and we still will allow you the opportunity to apply and receive funding from TGP. It just depends. I would also say for that question to reach out to each individual CC that you may be applying to question or to give them more details about this particular acts. For clarification, we have chose only one track on the transfer order to apply. The size say one application for CC. So multiple CCs have multiple tracks. So some of us have more than one focus area. So you can only apply for one focus area, and you can only apply for one CC. So you can't put in a transformative grant application to Emory and to UH at the same time. You can only put it into one CC. Right.
Also a question in the chat. Can you share the most common reason why applications are often rejected? Very simply, because people did not read the RFP and did not write to what the RFP was stating.
And I can also add for Emory, the work plan needs to marry the budget. Make sure that whatever you talk about in your narrative that you included in your budget, and vice versa. If you put something in your budget, you need to have talked about it in your RFP. They need to marry. And then also you need to talk about sustainability. That's, as Chris said earlier, that's big for us. So if you are implementing something new, we want to see how you plan to sustain it.
I want to add to the previous question around applying for multiple CCs. With this transformative grant, for this TGP grant, if you see how extensive each piece can be, you will want to make sure that you're spending your time being really intentional about why you're applying for the transformative grant, because you're trying to create transformation. So there's so much that can be confronting along the way, and you want to be so impactful in your community that you're just not doing the same thing that has always been recycled and done in the same way. And then on top of that, you want to make sure that whatever work that you are doing, that you're actually doing the work. So if you're like overstretched to capacity, then the way that you'll show up for these grants is going to show up. It's literally going to show up. And then you'll have a breakdown within what it is that you're out to create and really support those of us living with HIV in that way. So you want to be really intentional about why you're applying for the grant, and then think about what's missing, in the community in which you're serving, in the way in which you want to serve, what's missing. And that will also help you be grounded in why you're applying for a particular coordinating center, so that the time frame in which you're investing will be sustainable beyond your participation in this process. in the process, not just applying for the grant, but also once you receive the grant, how will you show up then for the community? The second thing is I wanted to mention why some of the grants are often rejected. Our review committees are oftentimes people living with HIV. They are your community in which you're servicing. They're not us. Now, I mean, I am living with HIV, but you get what I'm saying. They're not the team that stand before you presenting right now. So the scrutiny in which those review committees are giving or coming from, they're looking at like what they may have gone through before and the scoring process. So are you being innovative? Are you giving new language, or is it the same thing that they're always seeing and doing in the community in which how they're scoring from the language that you're using in your grant process? So are you using trauma-informed care language? Are you using MIPA language, in your application? So you just want to be really mindful of how creative or innovative you're being within your projects.
And I will add just logical. Sometimes we are reviewing grants and they just don't make a lot of logical sense. There are gaps in the information that are supposed to be in narrative. There are objectives that have not been fully vetted out. If you're going to take some time to write out this project, we're having this conversation today. I know some of you will start writing 2 days before it is time to enter this project because you have a lot to do and you're very busy people. And I wholeheartedly understand we're all very busy people in this day and age because companies only want to hire 5 people to do the job of 25 people. So I definitely understand. However, when you rush through the grant writing process, it is oftentimes reflected in what we read. And sometimes we don't, our reviewers don't get past reading a grant because it just doesn't make logical sense. So just basic communication efforts, making sure that the grants read well. Just a thought. Any other questions?
So yes, I want to go back to the question about if you can provide micro grants in your proposal. My answer to that will be reach out to whichever coordinating center you're planning on applying to and ask them specifically, because that will be a specific CC question, because it would determine where those micro grants are spent and what is the objectives of those micro grants will determine if it's possible or not.
All right. Any other questions, comments, concerns? Well, seeing as that there are none in the chat, here is our contact information. These are the people you may reach out and contact about the different applications. Should you find yourself applying, you may contact me at Emory Campus Coordinating Center. My name is Chris Matthews. You may contact the beautiful and the talented Miss Sonia Traylor at the University of Houston. You may contact the smart, the smart and the intelligent Justin Searcy at the Southern AIDS Coalition, or the phenomenal, the entertaining, the ever charismatic Marcus Howley at the Wake Forest School of Divinity. We are holding office hours at the Emory University Center. I know if you want to reach out to us, back to my original slide, you may contact us 9 Eastern to 11 Eastern on Thursdays, and I look forward to hearing from you. Should you need any support, I would imagine that the other centers also have set aside some time so that you may contact them and they will get back to you. We look forward to hearing from each and every one of you. And Marcus, go ahead.
Yes, I just want to say that that's Masonia's name and face. However, when you email, you'll be emailing me.
Okay. You will be getting the phenomenal, the talented, okay, the very cultured Marcus from the University of Houston, Marcus Stanley, to be exact. with that being said, we have ended our time, and I don't like thank you slides. I like action item slides. With all of this being said and talked about, apply. Please take the time out to apply for our funds because we look forward to working with each and every one of you and supporting the work that we do. So although it may sound like a lot to decide on, by all means, take the time out to gather your notes, gather your thoughts, get with your teams, because we believe here at Emory Campus Coordinating Center that we don't write grants in a silo, we write them in teams. Get with your finance department and your programs people and whatever other people you have to get with the people you need to get with and apply. We look forward to working with you in the upcoming year. And we look forward to continually working with you for the next couple of years as we disseminate the information we've learned in our multitude of partnerships. As we said earlier, over 500. We look forward to working with you in those new partnerships and serving the community in a multitude of new ways. Thank you so much for your time today. You have a wonderful afternoon, and we will see you in the writing. Thank you.